Hello, I'm Kirstin Weider. I'm a physical medicine and rehabilitation physician at Signe Spine and Rehab with a subspecialty in interventional spine and musculoskeletal medicine.
Hello, I'm Kevin Smith. I'm a doctor of physical therapy and a strength and conditioning specialist.
Oftentimes, when patients come to me with reports of low back pain, what we'll start with is what's called a neutral core stabilization program. So even though the primary pain generator, that source of the patient's pain, might be deeper than the core musculature, if we can really strengthen those muscles that support those deeper structures, hopefully we can start to reduce the patient's pain and ultimately get them back to doing those activities that they want to do as functionally as possible.
And it's important to realize that the exercises we select to do that are highly individualized for each patient. So Googling those things or looking them up online may not necessarily get you to your goal as quickly as possible.
And that's why I always emphasize the importance of working with a skilled physical therapist. Oftentimes, if you can even just get that initial assessment done, you can get pointed in the right direction with good exercises, proper form. But I also like to emphasize to patients, if they're concerned about a time commitment, that a physical therapist will work with you to make sure it works within your schedule, even if it's just once a week or once a month, making sure you're on the right track.
I think that's important to realize as well, is that while physical therapy can be a commitment, it doesn't necessarily need to be a large time commitment. So we're looking for 5 to 15 minutes per day of exercise, not necessarily an hour.
I love the analogy of brushing your teeth. So we brush our teeth on a daily basis, taking care of our teeth. We got to take care of our back on a regular basis too, ultimately making that part of our daily routine. Oftentimes my patients will tell me that first thing in the morning, they're doing 5-10 minutes of their exercises just to make sure they don't forget to do it that day. Sometimes even before getting out of bed. And that really helps just build it as part of that daily routine, help it with the longevity of the program.
Absolutely. And also, as a strength and conditioning specialist, we can increase your exercise capabilities if you have interest in that to go along with your current orthopedic context and condition. So the 5 to 15 minutes we discuss are critical, but we can also tend to reach higher and higher goals if interested.
And as a physician with training in interventional spine, there's a lot of tools that we have in our toolbox, the use of medications, procedures that can also help with pain relief. But ultimately, this foundation of a neutral core stabilization program can help reduce the need for those other interventions. So helping to reduce the amount of medications you're needing, reduce the amount of procedures, and hopefully get you back to what you want to do.
Absolutely.
So join us in these next videos as we discuss the neutral core stabilization program and what those exercises look like.
Let's do it.